my name is Madeline. I'm a student nurse from Purdue University Northwest, and I'm going to be following your nurse around and assisting you in your care today as well. So I'm just going to verify that I have the right patient by seeing your full name and date of birth. Okay, great. And I see that you're not wearing an allergy band. So you're allergic to anything that you know, whether it be food, environment, medications, or even seasonal allergies. Okay, great. So I already have my necessary equipment with what we're doing today. So we're going to be doing your section of your trach tube. And I've already performed hand hygiene. Curtains are closed in here and the door is closed to ensure your privacy as well. So I know I was just in here a minute ago explaining the reason why we're doing this trach tube. We just want to make sure that it's clear, that way you're getting oxygen properly. And I've already administered your pain medication because it was prescribed by your doctor before suctioning, just to ensure that this is going to be as painless as possible for you. So if you have any concerns while I'm doing this, feel free to interrupt me and I'll answer your questions to the best of my ability. So the bed is at a comfortable working position. It's at my elbow height. You're in semi-collar's position because you are conscious and you're facing me, which is great. Okay, so now I'm going to place a towel across your chest here. There's another nurse at the bedside, so that's why I could leave with the guardrail down. So this is your towel. And the section is at an appropriate pressure because he is a child. It's at 80 to 125. And now I'm going to put on my disposable clean gloves here. And I'm also going to occlude the end of the connecting tube to check the suction pressure before I apply this to your tube here. I'm also going to make sure that the tube is in a convenient location. And I have the resuscitation bag connected to the oxygen within a convenient reach as well, just to make sure that we have everything covered. Okay, so now what I'm going to do is I'm going to open the sterile suction package using aseptic technique, of course. So I'm going to open the wrapper container, becomes a sterile field, and hold other supplies. So I'm going to carefully remove the sterile container, touching only the outside surface, and set it on the work surface, and pour sterile saline into it. I'm going to put on a face shield. Or I have a mask, so I'm going to put on a mask, and I'm also going to put on goggles as well. And after this, I'm going to put on sterile gloves. So I'm doing this just to make sure that if there was any splatter while I'm suctioning, that I would be fully protected. I always like to tie the top portion of my mask around my ponytail just to make sure it's secure. Okay, now I have my goggles. I'm going to put them over my glasses. So I'm going to dispose of these gloves and put on my sterile gloves. Okay, so this is all over my sterile field here, only grasping the cup of my dominant hand with my non-dominant hand to put on the first glove here. Now that I have this first glove here, I'm going to scoop under with my dominant hand just like this over my sterile field and wiggle my hand in. Once my glove is on, then I can adjust the gloves to make sure I'm comfortable. So now that I have this on, with my dominant hand, I'm going to manipulate the catheter, and must remain sterile. So the non-dominant hand is considered clean rather than sterile, and I will control the suction valve on the catheter. So with my dominant gloved hand, I'm going to pick up the sterile catheter, pick up the connection tubing with my non-dominant hand, and connect the tubing and the suction catheter. So now that these are connected, I'm going to moisten the catheter by dipping into the container of the sterile saline that I have in my sterile field here. Unless it's a silicone catheter, and it's not, so I can go ahead and dip it. So I'm going to occlude the wide tube to check the suction. And now using my non-dominant hand in a manual resuscitation bag, I'm going to hyperventilate the patient, delivering 3 to 6 breaths or use the psi mechanism on the mechanical ventilator. So now I'm going to open the adapter on the mechanical ventilator tubing, or remove the oxygen delivery setup with my non-dominant hand, and using my dominant hand here, I'm going to quickly and gently insert the catheter into the trachea. So now I'm going to advance the catheter into the predetermined length, and I can't occlude the Y port when inserting the catheter. That's really important. So I'm going to apply suction intermediately, occluding the Y port of the catheter with the thumb of my non-dominant hand here, and gently rotate the catheter as it is being withdrawn. And I'm not suctioning for more than 10 to 15 seconds at a time. So now I'm hyperventilating the patient again, using my non-dominant hand in a manual resuscitation bag. Delivering 3 to 6 breaths. I'm going to replace the oxygen delivery device if applicable, using my non-dominant hand, and have the patient take several deep breaths. So go ahead, take a few deep breaths in and out for me. Great. So if my patient would be mechanically ventilated, which he's not, close the adapter on the mechanical ventilator tubing and use the psi mechanism on the mechanical ventilator, but we don't have to do that. So last, I will flush the catheter with some saline and assess the effectiveness of the suctioning and repeat as needed according to the patient's tolerance. So sometimes I will only have to do this once, sometimes I'll have to do it multiple times, but I have to remember that I can't do it for more than 15 seconds at a time. So I'm going to wrap the suction catheter around my non-dominant hand between attempts, and allow at least 30 seconds to 1 minute interval if additional suctioning is needed. And I don't want to make more than 3 suction passes per suctioning episode. And I want to encourage the patient to cough and take deep breaths between these suctioning attempts. So I'll suction the oropharynx after suctioning the trachea, and I'm not going to reinsert the tracheostomy after suctioning the mouth. So now that my suctioning is completed, I'm going to remove the glove from my dominant hand over the coiled catheter here, because I've been holding this the entire time. And I'm pulling it off inside out, just like that. So now I'm removing the glove from my non-dominant hand and dispose of the gloves. So I'm going to slip under here. Catheter and container with solution in the appropriate receptacle, which is right down here. It's gone. I'm going to assist the patient to a comfortable position. I noticed that my patient was here earlier, so this is where I'm just going to leave it, and this is also gone. So now I'm going to turn off my suction. I'm going to remove the supplemental oxygen placed up for suctioning. If appropriate, move the face shield, goggles, and mask here. So I'm going to remove my goggles. And I always want to make sure that I'm offering my patient oral hygiene after suctioning, especially because this can be kind of a not so great experience for them. And we want to make sure that the patient's comfortable at all times, if we can. So after I take off this here, I think I was tight in the back. So I'm going to reassess the patient's respiratory status, including their respiratory rate, upward oxygen saturation, and lung sounds, just to make sure that we've done everything that we needed to. And then now that I'm leaving the room, I would perform hand hygiene and remove any extra PPE if I used it, but I didn't. So that is the end of skill 38.6.